Anesthesia is supposed to make you unconscious during surgery, but some patients remain partially or fully awake, feeling everything, unable to move or communicate. And what happens during these experiences reveals how terrifying and poorly understood anesthesia awareness actually is. Let's start with what anesthesia awareness is. You're given anesthesia. You appear unconscious to the surgical team. Your eyes are closed. You're not moving. You're breathing through a ventilator. But you're aware. You hear conversations. You feel the scalpel cutting you. You feel pain. You try to move, to signal that you're awake, but you can't because you've been given paralytic drugs that freeze your muscles. You're trapped inside a paralyzed body, experiencing surgery, and nobody knows. Here's how often this happens. Estimates range from 1 in 1,000 to 1 in 19,000 surgeries. That sounds rare, but with millions of surgeries performed annually, thousands of people experience awareness under anesthesia every year. Some have vague memories of voices or sensations. Others have complete, detailed memories of their entire surgery. Now let's talk about why this happens. Anesthesia isn't a single drug. It's a combination. One drug makes you unconscious. Another paralyzes your muscles so you don't move during surgery. Another provides pain control. The problem: if the unconsciousness drug is underdosed, maybe the IV line isn't working properly. Maybe your metabolism processes it faster than expected. Maybe the anesthesiologist calculated the dose wrong. You wake up, but you're still paralyzed. You can't alert anyone. If you're learning about one of surgery's most terrifying complications, hit subscribe. We're exposing the anesthesia nightmares that happen more often than anyone admits. Here's a real case. A woman undergoing emergency cesarean section woke up during surgery. She felt the scalpel cutting her abdomen. She felt them pulling her baby out. She felt them stitching her up. She tried to move, tried to scream, couldn't. The surgery lasted 90 minutes. She was aware for most of it. Afterward, she developed PTSD, had nightmares about the surgery for years, and needed extensive psychological treatment. Let's talk about why paralytic drugs make this so much worse. Without paralytics, if you're too lightly anesthetized, you'd move or react, alerting the surgical team. But modern surgery requires complete muscle relaxation. You can't have patients moving while surgeons are operating. So patients get paralyzed. This means the normal signs of waking up, movement, changes in breathing, facial expressions, don't happen. You're screaming inside your head, and externally, you look perfectly anesthetized. Here's what anesthesiologists monitor to detect awareness: heart rate, blood pressure, sweating, tears. If these suddenly increase during surgery, it might indicate inadequate anesthesia. But these signs aren't reliable. Some people don't show physiological changes, even when aware. Others show changes from the surgery itself, not awareness. There are brain monitoring devices. BIS monitors that measure brainwave patterns, but they're not foolproof and aren't used in all surgeries. Now let's talk about the psychological aftermath. Patients who experience awareness often develop PTSD, intrusive memories of the surgery, nightmares, anxiety about medical procedures, panic attacks. Some develop chronic pain syndromes. Some refuse future surgeries, even when medically necessary, because the trauma of awareness was so severe. The medical community has historically dismissed these reports as dreams or false memories, which adds to the trauma, being told your horrific experience didn't happen. Here's a case that shows how bad this can get. A man woke up during heart surgery. He was aware for over an hour while surgeons operated on his heart. He felt them cutting his chest open. He felt them manipulating his heart. He heard them discussing complications. The pain was described as indescribable. He developed severe PTSD, couldn't work, his marriage fell apart, and he eventually died by suicide, partially attributed to the psychological trauma from intraoperative awareness. Let's talk about high-risk situations for awareness. Emergency surgeries where patients are critically ill and can't tolerate normal anesthesia doses. Cardiac surgery where maintaining blood pressure is critical and deep anesthesia might be dangerous. Cesarean sections where protecting the baby from anesthesia drugs means using lighter sedation. Trauma surgery where patients are unstable. In these cases, anesthesiologists intentionally use lighter anesthesia, increasing awareness risk. If this is terrifying you about future surgeries, make sure you're subscribed. We're also covering what can be done to prevent this. Here's what patients can do to reduce risk. Tell your anesthesiologist if you've had awareness before. It can happen repeatedly to the same people. Mention if you have red hair. Redheads require more anesthesia. Disclose all substance use, including alcohol and marijuana. Tolerance to these, affects anesthesia requirements. Ask about awareness risk for your specific surgery. Request brain monitoring if it's not standard. All of this helps anesthesiologists prevent awareness. Now let's talk about different types of awareness. Some patients hear conversations but feel no pain. They received adequate pain medication, but not enough unconsciousness medication. Some feel pain but have hazy memories afterward. They were semi-conscious, not fully aware. Some have complete awareness with detailed memories and full pain sensation. This is the worst scenario and, fortunately, the rarest. Here's something truly disturbing: explicit versus implicit awareness. Explicit awareness is when you have conscious memories of being awake during surgery. Implicit awareness is when you don't consciously remember, but the experience affects you. You develop unexplained anxiety, phobias about medical settings, panic attacks, or PTSD symptoms without understanding why. Studies suggest implicit awareness might be more common than explicit awareness, but goes unrecognized. Let's talk about what happens when patients report awareness after surgery. Historically, many anesthesiologists denied it was possible or blamed the patient. You must have been dreaming. That's impossible. You were fully anesthetized. This gaslighting compounded the trauma. Modern protocols require taking awareness reports seriously, documenting them, offering psychological support, and reviewing what went wrong. Here's a legal case that changed everything. A woman sued after experiencing awareness during surgery. She had explicit memories, could describe details of the operation that she couldn't have known otherwise, and developed severe PTSD. The case established that awareness is a real complication, not patient imagination, and anesthesiologists can be held liable if awareness results from negligence. Now let's talk about technological solutions. Brain monitoring devices measure electrical activity to assess consciousness depth. Processed EEG monitors like BIS show a number from 0, no brain activity, to 100, fully awake. Target during surgery is 40 to 60. These devices reduce awareness risk but aren't perfect. Some people show appropriate numbers while still experiencing awareness. Cost and lack of universal standards mean many surgeries don't use brain monitoring. Here's what's being developed: anesthesia drugs that combine unconsciousness and amnesia more reliably, better monitoring technology that detects awareness in real time, training programs teaching anesthesiologists to recognize subtle signs of awareness, protocols requiring increased vigilance during high-risk surgeries. But we're not there yet, and thousands of people continue experiencing awareness every year. Let's talk about the philosophical horror of awareness under anesthesia. You're completely helpless. You can't move, can't speak, can't even open your eyes. You're experiencing, potentially, the worst pain of your life. You have no idea how long it will last. Minutes feel like hours. You don't know if you'll survive. And nobody knows what you're experiencing. It's like being buried alive while someone operates on you. Still awake during surgery is a nightmare that medical science hasn't fully solved. For patients who've experienced it, the trauma lasts far beyond the surgery. For anesthesiologists, It's the complication they fear most. Doing everything right and still having a patient wake up during surgery, trapped and suffering. Understanding this risk doesn't eliminate it, but it emphasizes why anesthesia is far more complex and dangerous than most people realize.